What's up? I'm Hutch, and you need to better understand a manual pulmonary assessment so that you can better treat and evaluate your patients, and also pass the NPTE. Expiration takes double the time of inspiration and occurs passively. During inspiration, your ribs will move in two separate parts. The upper ribs will move anteriorly and superiorly like a pump handle during inspiration. The lower ribs will move superiorly and laterally more like a bucket handle during inspiration. Overall, your ribs should expand about 2 to 5 inches between expiration and inspiration. This is called chest excursion and is usually measured about nipple line using a cloth tape measure. You can also check different areas manually to see if there's a certain lobe or segment that may not be expanding as well as it should, both as far as the ribs go and the lungs themselves. You can check the upper lobes either in front of the patient or behind. Usually your thumbs go about midline, either on the sternum or on the spine, and your hands will go around the upper traps, and you're looking for equal expansion on both sides during an inhale. The middle lobes are checked around the fourth intercostal area, lower lobes are checked under the pectorals, and diaphragm expansion is checked under the ribs. Again, with all of these, your thumbs are going to go about midline. Just be a little bit careful about hand placement depending on who you're working with and which segments you're looking at. Another piece of the manual chest assessment will be mediate percussion. This is where you place your middle finger in an intercostal space. You then tap firmly with your other middle finger and you're listening for the type of sounds that it's making. So you want to listen one side versus the other side. You may check at a couple different levels, looking for differences in that sound, which may indicate different densities inside of the lung. So maybe there's a little bit of consolidation and you may be able to find out kind of where it is. And that's really important to figure out before you try to do any kind of treatment to get rid of some of that consolidation or congestion or whatever it is. Usually you'll perform mediate percussion to their back while they're in seated, leaning forwards, and you can perform mediate percussion to their anterior chest, either laying down or sitting in a more reclined position. Now it's time for NPT Jeopardy! Pause the video now if you want time to read and think about the question. Otherwise, you've got 5, 4, 3, 2, 1. The apex of the lungs can be assessed for movement at the upper trap area. This is a general estimate but can be useful in determining areas of concern between sides. Hopefully that covers all of our bases. If not, you can always check out the description box below for a link to my notes in Etsy, or you can comment with questions or suggestions for videos I should do in the future. Otherwise, good luck studying. Go change the world.